Welcome to the Mommy Collective. I'm Paulina Rowe, radio host, TV contributor, writer, and mom of one. This is where ambitious moms come to keep their identity intact while navigating motherhood. Here we talk about the real stuff: career, money, relationships, identity, and everything that gets messy in between. You won't find sugarcoating or cliches. What you will find are unfiltered conversations, real resources, and proof that you don't have to lose yourself to be a good mom. The Mommy Collective is here to remind you can be ambitious, you can take up space, and you can thrive in motherhood and in everything else that makes you, you. Before we get into the episode, make sure you're following the Mommy Collective on Facebook, TikTok, and Instagram, and share this podcast with a mommy in your life who needs a little inspiration or just a reminder that she's killing it. Also, don't forget to sign up for our newsletter and leave us a review so we can keep showing up and reach every ambitious mom out there doing big things. Let's get into it. Mommy Collective, Paulina is here. That's me, and I'm excited for my episode today. I get to chat with Dr. Maggie Grothe. How are you today?
I'm doing great. How are you doing?
I am doing so good. We're finally making this happen as moms. I think we both know the rescheduling, dilemma when it comes to like, hey, can I, I'm sorry, can I move this? And I'm so guilty of that. But I love when like moms just get it and they're like, listen, I
Yes,
freaking get it. So I appreciate you
absolutely.
first and
Yes,
foremost.
likewise,
Thank
likewise.
you. Thank you. So I'm happy you're here on the show today. Obviously, we're talking motherhood. We're talking your career.
Mhm.
You have two little ones that are about 4 and 2, give or take.
So three and a little
Three.
over 1.5. Yep.
Okay. So checking
Yeah.
in on you. How are you? How you doing?
I'm managing. I'm hanging. I'm still breathing. I woke up today, so it's all
Yes.
about
Yes.
perspective.
And you look so beautiful and great and just like put
Oh,
together. Like if I
you're
had
so
two under
sweet.
three, I would be like in my pajamas in a
Oh,
robe right now.
oh my gosh, you're so
Ugh,
sweet. Thank
of
you.
course, of course. I'm really happy that you're able to join me today. So first and foremost, I kind of want to talk to you about your career. So Root Dental, that is your
Yeah,
dentist practice, correct? Is that what
it
we call it?
is.
Dentist practice,
Yeah,
dentistry?
yeah. Dental office, dental practice. You got it.
I love it. So congrats on that. That's amazing. So this is your
Thanks.
like third baby.
Yeah, my husband jokes that this is our youngest and neediest child, is the dental office.
And I couldn't agree more. It probably is, right? As
Yes.
far as the demand and like everything that's kind of required to run a dentist office, which I think is just so interesting. And I love that you're a mom, you're a woman, and you're in that position. I think is just so incredible.
Thanks.
And again, with two little ones. So first and foremost, I'd like for you to kind of introduce yourself. And I like to ask people this question because I think it's very interesting. But would you say
Mhm.
you're a mom first or a dentist first?
Oh, wow, that's a really good question.
Isn't it?
Um, gosh, I think it fluctuates.
Mm,
Like right now, I kind of feel like I'm a dentist first because my practice is 10 months old and I'm just spending so much time on it. But
wow.
I think it fluctuates. Sometimes I feel like I can be a mom first, like even in the within the week. Like on Fridays, I feel like I can be a mom first because I don't see patients on Fridays. But on Monday, I feel like I'm a dentist first. So I think it really changes based on even the day sometimes.
100%. I mean, it's super honest. And I think that's very
Yeah.
real for any mom that's building a business, working, or, just has something going on like at this, degree. I think it's really like, it's very honest to just
Yeah.
say like, it depends on the day, time, maybe the season, you know what I mean? Is it busy
Yeah.
season? Is it like slower? I love
Mhm.
that. So tell us about yourself, your girls, all that good stuff. Where you located?
Yeah. Yeah. So my practice is in Algonquin, Illinois, so northwest suburbs of Chicago. And I grew up in the Barrington area, so not too far away. And yeah, so I've been practicing dentistry for about 4.5 years, but decided to open my own practice because I just got kind of fed up with, doing dentistry how I didn't want to practice it. I could go a lot into that, but the other thing too is, with two little kids, I got some advice like, don't open a practice, don't own a business, you're a mom, it's going to be too much. And I was like, yeah, screw that. No. Okay. Well, I shouldn't buy a practice, then great, I'll start my own. So
I love that.
so yeah, I got a lot of little birds chirping saying not to do it this way or that way. And one of the reasons I like to talk about this is hopefully to empower other moms that like you can do both at the same time. You can do both at the same time. You can be a mom and you can be a dentist or, whatever professional role and own a business. And there's a lot of things that, can set you up for success, like having the right support, but it's possible to do both for sure.
100% agree. I almost feel like my career kind of made me a better mom, even though my career was
Yes,
always first. Like it existed first, and then I became a mom.
100%.
But it made me better. You feel the same?
I totally feel the same way. And I think it works in reverse too. Like being a mom makes me a better dentist.
I love
And
that.
yeah, and I worked in corporate dentistry for a little while, which was a good growing experience, but horrible in so many ways. And I had this
Mm.
like quote unquote mentor who wasn't actually a mentor, and he told me after I had my first child, I came back to work and he goes, "You were a better dentist before you were a mom." And I'm like, um,
Oh
first of all, that's not
no.
true. I think I've grown so much since becoming a mom, which we all can say, of course, motherhood changes us in some wonderful ways. And I think the compassion and the patience that I've gained through being a mom has made me a better dentist, and being able to, clock out of being a mom and go into work and have some, a passion and a purpose outside of just, taking care of kids has really made those times with them so much sweeter and made like dinner time and bath time like so much more enjoyable because I know that it's limited.
100%. I mean, that's true. And I'm the same way too. I'm like, anytime that we get together and I'm not near a
Yeah.
microphone, a computer, nothing, like it is wonderful. So, was there a
Yeah.
moment that you can recall when you were like, I'm going to do my own thing? Like, was there like a specific, like, I don't know, somebody walked in and like slammed papers down and said something crazy and you're like, I'm out of here? Or like, do you recall that moment?
Yes. So it was when my first daughter was less than a year and a half, and I was pregnant with my second daughter, and I was like, you know what? I don't want to go back to working for someone else. I worked in six other offices before opening my own, and I was like, I can't achieve what I want to while doing this. So I started looking to buy someone's practice, so like a retiring dentist. And I was looking for several months for that, and I just wasn't finding it. And then I finally found one. And my daughter Whitney, who is my second daughter, she was 2 weeks old and she got RSV, so we had to go to the hospital because she was having trouble breathing, and she was admitted to the emergency room and admitted to the hospital. And when we were checking out from that really scary moment in the hospital, 48 hours later, I got a text message on my phone saying that this practice, which I was set to buy, like the papers were getting signed, I was just waiting for like the final okay. I got a text message saying, "You were outbid, all cash offer. The deal's off." Which for reference is incredibly unprofessional. You shouldn't do that. There
No.
should have been some counter or something like that. And I literally was looking at my phone, seeing this, carrying my 2 week old out of the hospital, and I just started sobbing. I was like, I'm done. I'm done waiting for someone else to be ready to start business ownership. I'm tired of being able to not being able to do dentistry how I want. I'm just gonna start my own. I'm just gonna start from scratch. So that's what I did. Started watching business ownership videos while I was on maternity leave, and, talking to banks and all these things. And it was like maternity leave wasn't really maternity leave the second time around because I had my little Whitney in my arms and was doing all this research on business ownership and meetings and everything. And so just jumped right in.
Yeah, no, you wasted no time. But you know
No
what's
time.
crazy? It's like my postpartum experience, I kind of was the same. I'm gonna
Yeah.
be very honest. I took 6 weeks off of work,
Oh
and
my
for
gosh.
reference, that's nothing, right? Like
Nothing.
people,
No, it's not
I
enough.
know a lot of that was my own fault. I do own up to it. I'm just like, I'm kind of ready. I kind of want to because I sort
Yeah.
of had the desire to like just continue what I was doing and like, my schedule was very set up where like it could work and stuff. So I was like, you know what, I kind of want to go back earlier than later. So like my
Yeah.
maternity leave really wasn't like it was the same as you. I was just working on this and that and just getting my hands into things. And I don't know if
Sure.
it just kept me, I don't know, busier, like in the sense of like it became me happier, which is amazing because then I
Mhm.
felt like my purposes were all, or my cups were getting filled everywhere. And like with my daughter there, it
Yeah.
was just like the best. And I had like a lot of
Yeah.
help too. So I always say like I had a great postpartum experience. Like, yeah, I mean, did I cry and like have to wear diapers? Of course. But like I just felt like
Yeah.
good about it, It was like it was very nice. And like sometimes I do look back, I'm like, all right, I should have sat my ass home a little longer, but no regrets. No regrets. I love it. So, okay, got it. So we then open up this new dentist office, and how old are the girls when this is like good to go or in?
So gosh, because it's been a process because I started it literally from the ground up. So construction, everything. Had zero patients to start. So that would have been December of last, just not even a full year. So they were, gosh, 1.5 and 2.5.
Wow.
Is that right? I think. Yeah.
About,
It feels like
yeah.
a blur. I think that it wasn't even a
I
year ago,
know.
and I'm like, what happened in the last
Isn't it
year?
insane? So
Yeah.
a lot of times like what I like to emphasize and talk about is the village, right? And everyone's village looks so different. And like
Yeah.
for moms like us to make these things kind of happen, it does require a village. And I
Oh my
personally have
gosh, yes.
no shame in that. Like I would move my village all into this house if I could. If I really everybody would like have a space because I'm just very fortunate for that help. And like
Yeah.
I always feel very grateful for that. So do you as a mom of two and like a full-time business owner, what support makes this all possible for you so that you can do this, right? And kind of how did you build your village or your support system? Is it your
Yeah.
parents like helping? Is it your spouse? Is it daycare nanny? What do we do?
Well, I love that you're talking about this because I love that you bring that up and what you had to say because I completely agree. I think, I've had some people say to me, like, I don't know how you do it all. And I'm like, well, I don't do it all. This is not like, raising a family, however that looks, or owning a bit, like it's not a solo sport, it's a team sport. Like it takes a lot of players to play this game.
Yeah.
So, my husband and I are a great team. I could talk about how supportive and wonderful he is for hours. I mean, he was the best decision I've ever made was having a life with him. He's just absolutely phenomenal. He was the one that gave me the idea to do a startup.
Love
He was
it.
like in the very beginning, he's like kind of putting the little bird in my ear saying like, why don't you start your own? Like, why don't you do it? And in the beginning I was like, no, I can't do that. That's so stressful. Like that would be way too much. And he's like, you could do it. If anyone could do it, you could do it. So he's phenomenal. He does the daycare drop-offs. He helps cook and clean and everything. He's a true partner in every sense of the word. So I have to give so much kudos to him. Um, he's a big leader in our village. And other than that, my parents are phenomenal. They're so helpful. They live like 10 minutes away. We moved back to be close to them, and they're phenomenal too. So definitely have a lot of people supporting and helping us out.
I love that you lean on the village too, because I couldn't do
Absolutely. You
without
have
them
to. You have to.
all the time. Literally. I love it.
Yep.
And then so is your husband involved in your business as well, or does he kind of do his own thing?
So he has his own full-time job. He was really helpful kind of in the beginning, and he did a lot of like helping with like talk to banks and stuff because there was so much to coordinate that I was like, I can't do this on my own.
Yeah.
But now that we're kind of getting more like up and running, he's kind of taken like just kind of like a helper position. So he will go to like events and table at like local events, which is amazing because then it gives me time to be with the girls like on Saturdays, things like that. So he's still like helper number one, but he does have a full-time job outside of the office. So yeah.
Amazing. You guys are just doing
Yeah.
everything in this household, and I love it. No, you guys are
Oh,
awesome. You're a
thanks.
great, amazing team. So, I personally, I hate the word mom guilt. You know, I do. I
Oh my
hate
gosh,
that
yeah.
word. Is
Yeah.
it real? Yes, but like, why do we have to
So
keep like
real.
reminding ourselves about it? But I do want to ask, just because you do so much, and obviously running your own business
Yeah.
and two little ones. So, like, have you felt the mom guilt when it came
Oh
to
my
like your
gosh,
work
yes.
and stuff? Yeah. How do you
So
reframe
much.
it if you do?
Honestly, it's really hard. It's tough. Like, and I'll kind of speak to like I have with dentistry, I have like the business owner side, but also the clinical side. So recently I've been doing a lot of like continuing education where I'll fly to Dallas or I'll fly to Charlotte. So like a couple weeks ago I was at a course in Dallas, and because I was at this, continuing education course, I missed Evelyn's first soccer game and I missed her school play.
Oh,
But my husband and my parents were there the whole weekend, and I think it's hard because it's you do miss some stuff, I think, and I think it's important to give ourselves grace that like as long as someone is there to love them, like it balances out. So, as long as they feel loved and supported and feel presence from people that love them, like that's kind of how I help myself reframe it. So, I would FaceTime in and I would ask for pictures and send them pictures. And, I don't think they're going to remember that I wasn't there for, those things. But I will say there's one book that really did kind of change my perspective on it was Tough as a Mother. And it's written by a bunch of female athletes who are moms. And
Wow.
they talk a lot about that. So, like any mom who's experiencing mom guilt, read that book because it really helped me, to be able to kind of reframe as like as long as someone who is consistently there is loving them, like it'll balance out. And also just being present when I can and being there when I can and reminding myself that like I'm doing this for them. Like I'm building this business to set up a good future for them. So, yeah.
Absolutely. And I love that that you say that because one thing that like sometimes like my husband, he has two jobs right now, right? So like when
Yeah.
I'm done working, like my full-time job, I do radio. When I come home, it's like I'm with the baby most of the time. I
Yeah.
have my village, so don't you think they're still here. I
Yeah.
always my mom after work, she'll take Gigi for a little bit and I
Aw,
get more work done for Mommy Collective. Like it's a lot going on in this house. But I
absolutely.
always tell my husband because I feel like he's got dad guilt, which is so interesting too. And I get it
Oh,
because
yeah.
he's literally gone all the time. He's home maybe one day a week,
Yeah.
if that. So it's not great. But I do tell him, I'm like, well, A, she's not gonna remember. The girl doesn't know where her nose is. I mean, she does, but sometimes she doesn't. But also number two, I'm like, I also want her to like I also want you to know that as long as she feels love and presence, like
Yeah.
that one of us are there and like plus we have like his parents and my parents 5 minutes away, we're the same as you guys.
Yeah.
I'm like someone's always there. Someone's always
Yes.
and that is a blessing. That is I'm grateful for it. I get it. Everybody has
Yeah.
that, but I want him to understand like it's okay because also Gigi and this is how I look at it too. Like my husband and I we don't really come from like a lot of like wealth and other shit like that. So
Sure.
for us, we're like, we want to help build and not even just like wealth. It's just more of like, I want to establish like a really good road for my daughter.
Yeah.
And she may not understand it today, but she will when she's older. And I'm trying to
Yep.
tell him like, if what you're doing is helping our family, you're not out here like partying or like going to like a golf course. Like, and even if you did one day
Right.
a week like, or one day a month, like I'd be fine with it. But you're
Absolutely.
you're you're building something for our family. I'm building stuff for our family. Like our daughter gets to reap the benefits of that. What better
Yeah.
love are you showing her or giving her? Like, you know what I mean? Like
Absolutely.
I wish that my parents and his parents too, they were both young. It's like a different circumstance, right? Like his parents were teens. Like my mom was very, very young too. She was like 22, I think. And I say very young because I'm 32 when I had my baby. But
Yeah.
it's like I wish that our parents had the knowledge, the resources, everything that we had. But again, it's generational, right? So it's like
Right.
they did what they did for us. So now it's our turn to do the same for our daughter and better. I always
Yes.
say my daughter she better be better than me. You know what
That's
I mean?
right.
In every way, shape, and form. Like she better outperform and run circles around me because
Heck yeah.
that's my goal in life is to make her the greatest version of herself.
Yeah.
So I always tell him like I get it, you have the guilt because I have it too. Like, I have to be somewhere tonight for a movie thing, and I have guilt
Sure.
about that.
Yep.
But I'm also like, okay, but like mommy is doing this so that like quite literally we're going to Disney or Universal in 2 weeks.
Amazing.
But
Amazing.
if
But like,
mom
and
is
if you weren't working, you wouldn't be able to do that.
I'm gonna be honest, because we would have to cut
Yeah.
back. We would have to, 100%.
Yeah.
And like now we get to go do these things with our daughter. Like I didn't get on a plane
Yep.
until I was like 18 or 19. Okay, I'm gonna be so
Yeah.
honest.
Yeah.
And I'm just like, but it makes me happy because like she gets to see her characters and like all these moments that like
Yeah.
I never got as a kid. So I'm really excited. So I'm gonna stop
Absolutely.
rambling. I'm sorry, but I
No,
try to
you're
tell
so
parents
right
that.
though.
You
Absolutely.
know?
And I don't know if you can relate to this, but like, you know, I'll talk to my mom and she'll say, like she would get kind of frustrated and my parents are phenomenal. They're still very happily married, but she would get kind of frustrated when like we would go on vacations when I was like really little and I have two siblings, so there's three of us. And my dad would have to like bring his laptop and work sometimes because he was starting a business. And she'd be like, you're not around as much. And like she understood, but like she just has memories of like feeling like he wasn't as present on vacation and stuff. And I never remember any of that. All I remember is like dad was really good at playing. And he would play in the pool and we would have fun and, do
Yeah.
these things. So it's like, I think sometimes we have to give ourselves grace because we take it more seriously than they do.
Yeah.
And as long as you have like really good moments, those outweigh the ones that you're not there.
I agree 100%.
Right?
No, I 100% agree. I can't even think of a memory. I'm trying to think where I'm like, you weren't there. It's in that sense,
Yeah,
right? Of like we were on vacation or whatever. Like I felt like there was, even though my parents worked, I felt like actually a lot more than me and my husband do, but I feel like there was always, I'm going to frame it this way. With my husband and I, there's always somebody there to take Gigi to dance or watch her do this or do that, right? She's
yep,
also 1.5, so we're not really doing much. But when we are, there's
sure.
always someone taking her. Like, I'm
Yeah,
not even going to lie. Like, my mom, and like, she never really came to much or whatever. And it's because like, but like neither of them did, right? I had my stepdad and my
yeah,
mom. To be honest, neither of them did. And they get it. They were working, so I'm not going to hold it against them. But my daughter will have the opposite again because there will be
yeah,
someone in that crowd, whether it's grandma, whether it's her aunt, me,
yep,
Javi. There's always someone, so that already is a huge difference. From 0 to 1 is a big difference, you know.
absolutely. For
So
sure.
I know, but
Love it.
I love your advice, and I think it's a great way to reframe it. So I love that. So I kind of want to talk about your business, right?
Sure.
What's sort of the, I know the motive behind it and I love it. What's sort of like kind of your business structure? Like do you like have like you're fully staffed, I'm assuming, like do you bring in
Yeah.
people like that are kind of like you, like ambitious, like moms, like when you look to hire, like what do you look for as a business owner?
That's really interesting because we've actually had quite a big transition with our team recently, and I
Wow.
have a new patient care coordinator, so front office, and two new dental assistants. And things that work really well in my office and work really well for our team are positivity is huge. So one thing that we have like team agreements,
Mhm.
and one thing that is really important to me and like we have all agreed upon is like being able to like check your baggage at the door and check your bad day at the door. So the example that I always give is like, I've got 1 and 3-year-old girls, and sometimes they don't sleep. But my team should never know if I have was up half the night. Like they should never know if I'm exhausted or I'm stressed out or,
Right.
if something's going on at home. They shouldn't know that because when we're at when we're at Root Dental, part of building that patient experience and having that really good culture is being able to set your own personal problems aside and show up for your team and show up for the patients. And I think that's really been a big thing that will continue to make us successful is being able to provide a really good or build a really good culture off of positivity and hustle. Like I say, like everyone that works in my office is a hustler. Like we're not there to complain. We need to be action oriented. So those are really big things for me that I look for is instead of saying like, "Oh, I'm so annoyed with this," flip it and say, "I'm kind of having trouble with this. Can someone help me?" And I think that perspective is huge, not only just in work, but like in everything. Being a working mom, it can be easy to like complain about things, but you can accomplish a lot more when you flip that perspective and have a perspective of gratitude and being able to work through challenges.
100% agree with that. Well, that's great advice and great leadership too on your end. Because
Well,
it's
thanks.
important. I think it's so important. So,
Yeah.
because you're here with us and you are a dentist, and
Yeah.
I don't think we've had a dentist on the show, so I have a lot of
All
questions
right.
for you for the moms who are
Let me hear them.
listening and they're like, okay, I got questions when it comes to my
Yes.
kid. So, okay. First and foremost, tell us about your first dental visit. When should a kid go to the dentist for the first time?
Great
Because
question.
I just took
Great
mine,
question.
so I gotta know.
Yeah. Hey, look at you. And a girl, way to be on it.
Yes.
So the recommendation from like the American Academy of Pediatric Dentistry is first tooth or first birthday, whichever one comes first. Which seems super early, but the reasoning behind that, I would say even like 1.5, 2 at the latest would be, to get them acquainted with the dental office. So we do like happy visits for like first time. Meaning
Oh,
that the kiddo comes in, we give them the little sunglasses to put on, and we show them, the little suction and say, "This is my silly straw, and this is my special tooth mirror," to just kind of like show them, what all the little things are, and talk to them. And sometimes they open their mouth, and sometimes they don't. A big thing for me is never forcing a child. I will never hold a kid down. I will never say like, "Open your mouth." Like they have to be willing. because that's how dental trauma happens. So having those first few experiences to like kind of warm them up to the environment and to the team and all the different things, um, that's what I recommend is the earlier the better. And then by the time they are 3 years old or 2.5, like maybe they will just like lay and let open their mouth and let me see their teeth so that I can actually assess for if there's any issues. But the other thing too is, things that your dentist should be looking for are, outside of are there cavities, is, let's assess their airway. Let's assess how are they sleeping? How are they breathing? Are there signs of like development? Like how is their oral cavity developing? The roof of their mouth. What habits are there? Is there a pacifier habit? Is there a thumb habit? Let's try to intervene before that becomes an issue. Because a lot of these habits that are started and developed early on develop into bigger whole systemic issues. So even like crowded teeth that, require orthodontics, like early enough along or early enough, you might be able to make some lifestyle changes or habit changes that can prevent that.
And that's important. I remember too when
Yeah.
I took my daughter, like they mentioned that, and they actually told me a couple things too that I wasn't or I didn't really think of, like about brushing teeth and stuff. What
Yeah.
do they say about like people after the age of 1? I know some moms still nurse at night, so
Sure.
like they mentioned that part too. But and this is so silly, but I don't know why I didn't think of it. But they were just basically like saying like because I was like I give her milk at that time. I was giving her milk right before I put her in the crib,
Yeah.
and that wasn't the greatest thing that I was
Yeah.
told I could do, and so now we
Sure.
switched it. She has her milk downstairs, then we do bath, teeth, and then book goodnight, you know? So,
Amazing. That's great.
but see, I didn't know that. I was still giving her milk
Yeah. I
right
mean,
before the crib.
how would you know? Unless yeah,
Exactly.
absolutely.
So little things like that I feel like are very important. Again, like just
Yeah.
to visit the dentist, get acquainted, get like used to it, and then
Right.
ask all the questions that you have. So
Yeah.
very interesting. So when it comes to pregnancy too, because a lot of pregnant moms are listening to, right, or they're
Yeah.
becoming mothers for the first time. What
Absolutely.
changes should moms watch for, and when should they call you, right? When they're
Oh my
pregnant?
gosh, there's so many things. There's so many things that change in the mouth based on, hormones and pregnancy and all that.
Oh, I didn't know.
So there's a couple things. Gums can bleed more. You can have more sensitive gums, so there can be more inflammation in the mouth. So that's something to kind of keep on track with. A lot of things that I see too is that, obviously with pregnancy, some women get, the acid reflux when the baby gets bigger, or, some morning sickness or all day sickness. Things
Right.
like that. But all of those things affect the mouth and the teeth. So one thing that I tell moms is, if you do get sick, don't brush your teeth right away. Or even if you feel acid reflux, don't brush your teeth right away because the mouth is still acidic. And if you brush, you can break down tooth structure. So if you get sick, rinse your mouth out with water and then wait 30 minutes and then brush. Or if there's acid reflux, rinse with water, don't brush right away, things like that. Because a lot of those acidic things can break down teeth, and once you break down enamel, it never grows back. So that's one thing. Another thing, especially with like postpartum, for
Hmm.
especially for nursing moms, um, super hungry, right? Like breastfeeding, I feel like I could eat an entire fridge in a day.
Yes.
Um, so things to keep in mind for that are just incorporating certain techniques and tips so that if we're eating all day long, it's not an acidic environment for the mouth all day long because it's not only what we're eating that can increase risk for oral disease, but it's how often, what time of day, what order we're eating things even. So it all makes a difference.
100%. Okay, that's
Yeah.
awesome and good to know. So now
Yeah.
I want to I kind of want to bust some of the myths that you hear. I'm sure there's
Yes.
several, but I want to talk about when it comes to fluoride,
Oh boy.
SDF, and then the holistic approach, right? So what do you
Dang, here we
actually
go.
recommend? And like what should
Yes.
we do?
Yeah, so fluoride's really interesting. So I say we're a fluoride conscious office because we're not anti-fluoride, but we're not like let's slap fluoride on everybody. So we don't even offer fluoride varnish in our office. We do a nanohydroxyapatite varnish instead. Um, I think the thing with fluoride is yes, it can be toxic at certain levels. So I recommend not using fluoride toothpaste until the child is very good at spitting, because if they're swallowing it, that can become a problem. I'm I'm kind of on the fence though, because a lot of the criticism and like the papers that I've seen that criticize fluoride say that, it lowers IQ levels. The thing is that that's really hard to test because there's a lot of things that go into like IQ levels. So, I think we're at a really interesting time that I hope the dental community, and we're not really doing this right now, but I hope it gives us some time to reflect and retest. Because if there is an issue with like fluoride in the water, great. Maybe we remove it and see what happens. Like I'm all about like let's test it again. Let's see, because the other thing is I also worked at a pediatric dental office for a while, and it was in a fluoridated community, and there were so many kids that came in with a mouthful of cavities. I mean, it was unlike anything I've ever seen in my life. Like I could not believe how many children came in with just bombed out mouths. But most of them had fluoride in their water and they used fluoride toothpaste.
Oh, wow.
So my philosophy, and kind of like when you really look at the science, like fluor cavities are not a result of a lack of fluoride. And I think sometimes as a dental community, what we do is we just treat fluoride as like the superhero of oral health. But just slapping fluoride on teeth is not going to fix what actually is causing cavities.
Mhm.
There's so many things that go into risk for cavities. So we need to look at diet. We need to look at, is the person breathing through their mouth? We need to look at stress. We need to even look at like nervous system imbalance can affect cavity risk. There's so many things that go into it where like, let's look for the root cause, which is why my office is called Root Dental, as
Yeah.
opposed to just saying like, oh, you have a lot of cavities. Well, let's do fluoride varnish, drink fluoride with added water in it, do fluoride to like, okay, that's fine, but it's not going to solve the problem if there's something else going on here.
Yeah. No, that's
Does
very,
that answer
very
your
true.
question?
Yes, no, 100%. Because I think about that for my daughter too. She's 1.5, right? And like,
Yeah.
I actually wanted to follow up with that question too. So, what do you
Yes.
recommend if you have any recommendations for toothpaste for a
Yeah.
1, 2, 3-year old, like a little kid?
Absolutely. Absolutely. So we use Risewell in my house. It has nanohydroxyapatite in it. So
Mm.
nanohydroxyapatite, that's a really fancy word, but what it is our tooth, the outer layer of our tooth, the enamel, the white part, is made up of nanohydroxyapatite. So the reason that it's okay if children swallow it is that with a certain brand, you have to be careful. They're not all made the same, but with a certain brand, if it's swallowed, it just disintegrates into calcium and phosphate ions, and it won't hurt you.
Mm.
So, depending on the brand, it's safe. So, like my 1.5-year-old, she uses this Risewell toothpaste, and she like sucks on the toothpaste and like swallows the whole thing. But it's not a problem because it's not toxic because of how it's metabolized. So that's what I recommend for little kids is Risewell. Once they can spit comfortably. So like my 3.5-year-old, we use Hello brand because there's a lot of junk in toothpastes, but things you want to watch out for are like artificial dyes, artificial colors. SLS is an ingredient that really irritates the tissues and cause canker sores. There's carrageenan is another one that can exacerbate GI issues. So there's a lot of ingredients in toothpaste that you want to stay away from, but Risewell is good for non-fluoride. Hello brand is good for if you want fluoride.
Okay, good to know.
Yeah.
I'm Googling right now. I'm gonna try Risewell. We
Yeah.
did another one that was supposed
Yeah.
to be pretty safe. Let me see if I could pull her up. She was like pink, I think.
Is
I'm
it
trying to think.
Boca?
I'm gonna look right now. I think
Yeah.
so. But I didn't buy it because I
Yeah.
was like, I'm gonna look for a different one. She wasn't
Sure.
bad. She wasn't, here she is. Attitude.
Yeah, I'm not
Attitude
familiar with that one. I'd have to look
baby
it
and
up.
child fluoride free training toothpaste.
Let's see.
Yeah, I
So
don't
the thing
know.
with the thing with toothpaste is you want something that remineralizes, because I see a lot of patients too who do non-fluoride toothpaste, which is fine. But if there's nothing to remineralize, which means to like what's a good way to say this? To like rebuild the tooth, um, then it won't do what we want it to do.
Got it.
So look for, that's where the fluoride is beneficial, but that's also where nanohydroxyapatite can be beneficial as well.
Love
was
it.
trying to
Well,
look up
try me
this.
some Riseways, right? Riseways, I think it was. I'll
Rise
try
well,
that one.
yeah.
Risewell, Risewell.
And the pro line is better than
Okay.
the just the regular one, and you can buy both. But
I love it. Well, thank you for that one.
yeah,
So, what
so
about as far as like moms listening, families, what are some ways they can plan for dental expenses across the year, right? Because with
yeah.
kids, I feel like you never know.
Oh
I
gosh, you never
had
know.
silver teeth when I was a kid, and there's a term for that. Then it's not called silver teeth, but
Sure, I get
I
you.
was a silver tooth kid, and then
Yeah,
had cavities, the whole deal. So, like, I can't even imagine what my mom spent on that. So, how can families
yeah.
better plan for these situations?
Yeah, it can be really stressful because dentistry is not cheap. That's just, that's just kind of part of it. It takes a lot to do dental procedures financially, so it takes a lot, to afford them
For
from the
sure.
patient side as well. So, our office does have like a membership plan. So, whether you come to our office or another one, that could be a really good way is if they have an in-house membership plan because you can get a lot of discounts that way. Um, and then, with our office, we also offer a lot of like third-party financing to like stretch things out. So, being able to find a practice that will kind of work with you, be careful with dental insurance because it's not insurance. It's a
Mhm.
coupon. So that can be really shocking for people too, is like really look if you do have insurance, really look into it because a lot of times they'll cover, like $1,500 and then after that they're like, "Oh, well, the rest of it's on you." Whereas the term insurance makes us think that it's just all covered.
Mm,
But they'll insurance companies will do whatever they can to not pay for things. So,
of course.
if you do have that, really look at all the things in the contract because that can be really surprising and challenging for some people.
Absolutely. Well, thank you.
Yeah.
That's, I think, amazing advice. So, my last
Yeah.
question for you is
Yes.
for moms listening again, if there was like one small thing that they could do right now, that, literally do today that your
Yeah.
future smile will thank you for and your kids, what would that be? Like, what would that be for you? What do you think they can do as far as, for me too, I'm a mom listening. So, if I want
Yes.
to thank my future self and for my daughter for our smiles, what can we do?
I love it. That's a great question. So I'll give you two. I'll say one thing for your kids, especially like little kids. Um, Try to stay away from purees. So
Ooh,
like baby
interesting.
food.
Okay.
And there's two reasons for that. When you take a fruit or a vegetable and puree it, it releases more sugar and it removes the fiber. So that
Mm,
increases your risk of cavities significantly. The other thing is when we opt for like whole foods, like baby-led weaning is a popular term right now. It not only is better for our teeth, but in terms of like not subjecting them to a bunch of sugar,
mhm,
but it's also better for oral development because our jaw and our muscles need exercise to properly develop at that age. And when we eat a lot of processed foods, a lot of soft foods, our jaw doesn't get the exercise that it needs in order to help it properly develop, which is why we're seeing like over 80% of kids nowadays need braces because we eat a lot of processed foods, in this country, and that has, given us less time for chewing. And that chewing is what helps those muscles develop and that jaw develop. And when we don't have that, we have less space in our mouths, and that's why teeth come in crooked because there's not enough space. So one thing that we can do as parents for our kids' oral development is try to eat whole foods, less processed stuff. And try to get them chewing. So eating meat like steak, things like that, crunchy vegetables, things like that, where they have to like exercise their mouths for good oral development. That's one thing that I would say.
that's so interesting. Okay.
Yeah. Yeah.
Okay.
And then probably for adults, one thing that will help. So we do like nutrition counseling at my office. I'm really passionate about like whole body wellness and oral health and part of that is, what are we eating?
Mhm.
One thing that I see often is like snacking throughout the day or drinking
Mhm.
beverages throughout the day. So our mouth needs time to recover whenever we eat or drink anything. And so, I see some patients that have, frequent snacks throughout the day, which, is fine, but that means that our mouth is in an acidic environment, regardless of what it is, for
Yeah.
most of the day, and that acid is breaking down our teeth. So I try to counsel patients on, making specific meal times like breakfast, lunch, and dinner, maybe an afternoon snack, and water. for most of the day. Try to drink your coffee within 20 minutes. I know. I know I love drinking coffee throughout the day too. But try to drink it quickly and not spread it out throughout the day. And that'll really help your not only your oral health, but it helps your gut kind of recover too.
Oh my gosh, I didn't know that. Well, thank you so
Yeah.
much for being here with us today and for sharing all of that, Maggie. You're the bestest. Where can we
So
see you? Where can we, if you're taking new patients, where can we go? And what's a good website too to check out?
yeah, so our website's rootdental.net. You'll get a lot of good information there. And then we're on Instagram and Facebook. So our Instagram is Go Root Dental, and we try to be pretty active on there and spread information and education and some fun. So that's how you can find
Awesome.
us. And we're always taking new patients. So happy
I
to help
love it.
out whoever wants to be served.
I love it. Maggie, thank you. You are the
Yeah.
best.